red blood cells would be polycythemia. Okay, so some people say, oh, there's a lot of red blood cells, we have more oxygen. That is not the case, because it will increase traffic, which is increased viscosity. And when there's a problem with too little red blood cells, and then you have anemia. Okay, some of the things that you need to have good blood and nutrient, which is the good nutrient, iron, copper, and zinc, and all these things. Okay, whenever, for example, as I mentioned before, erythropoietin is released by the kidney and then target the red bone marrow. So if you have a kidney problem, you have a problem making red blood cells. Okay, and then you will have a change in the level of red blood cells. So life cycle of the red blood cells. Okay, so you begin your life through incorporation of the kidney, GI tract, and bone marrow. You circulate for about 120 days. Okay, loading and unloading gases. You're worn down and you rupture, and then you are recycled. Macrophage and the liver and the spleen will process the hemoglobin. Okay, whatever is usable will be reused again. So production must keep pace with destruction. So your body is always making red blood cells, because about 120 days you will lose a red blood cell. Okay, your body makes about 2 million per second in the bone marrow. Much of it is recycled. Okay, the only thing that is not recyclable, only exception, is the non-heme, okay, non-iron heme group. This is processed by the liver and is mostly excreted. So one of the things that is non-recycled, let me see if it shows here. Okay, well, the non-heme group, okay, first it will be converted into the biliverdin. Verdin is the green pigment. Okay, and they will turn into the yellow pigment, bilirubin. Okay, used to make biles. Okay, and then the other iron and whatever it is recycled. Okay, and you can read all this here. The unused heme group can be recycled and used in hemopoiesis, or can be converted into bilirubin and used to make biles in the liver. Okay, the iron ion can also be transformed. Ferritin. The heme protein is broken down into the biliverdin. Oh yeah, this is the one before. Okay, biliverdin, which is the green substance. Okay, into biliverdin for transport to the blood. The iron. Okay. Let me see. Disorder of the red blood cells. Okay, size, shape, and number of red blood cells and hemoglobin. When the number of red blood cells or hemoglobin is deficient, when you don't have enough, it's called anemia. Okay, three causes of anemia: blood loss, faulty or decreased red blood cells production, excessive destruction of it. Result, if you don't have enough red blood cells or you're anemic: hypoxia. Okay, hypoxia, you don't have enough oxygen. This will create many problems, increased workload of the heart and lung. Causes of anemia: blood loss, for example, hemorrhage, okay, ulcer. Faulty or decreased red blood cells, like these, okay, supposed to be round. Okay, this is called sickle cell. Okay, it's genetic, sickle cell anemia. Okay, because of the shape, it doesn't carry oxygen properly. It doesn't go into the to the capillaries properly, and then it will cause sometimes the tissue will not have, without enough oxygen, the tissue will die. Okay, another problem that causes anemia: radiation. Okay, cancer and all that stuff. So again, a little bit of this. When there's not enough oxygen going into, wherever it needs to go, sometimes you have joint pain, blindness, stroke. Okay, usually African American descent, or sorry, not African descent will have this genetic disorder. A lot of them have. Now this is now too many of them. Okay, excessive red blood cells will cause traffic. Okay, and this will cause slow flow. Okay, again, it's the same as increasing resistance. Polycythemia vera is a bone marrow cancer. Okay, it's a cancer of the bone marrow. It's making too much red blood cells. Secondary polycythemia, when oxygen is low, EPO increase, high altitude, is severe, then remove the blood and replace with saline. Okay, too much when you're in a high altitude. So now we're going to go into white blood cells. Okay, white blood cells. This is where that chart comes in. So white blood cells, okay, is to help defend and to clean up. They have organelles and nucleus. They're larger than red blood cells, but far fewer. Okay, they can leave the vessels. Do you remember when we did the vessels? They can go through sinusoidal, fenestration, and then just leak. Okay, there are 5 types. For example, in this case, okay, there's an injury there, and then it will leak and kill bacteria or whatever it needs to do. Okay, it will leave the circulation. Okay, called diathesis or immigration. Okay, to defend the body tissue. They're also going to use chemotaxis. Chemotaxis is a signaling molecule. Okay, so for example, here it will signal other and more white blood cells to come over. That's called chemotaxis. Classification: there are 2 types: granulated and agranulated. Okay, so it's when you look at the microscope. Okay, look at the microscope. Okay, you see these things. Granulated nuclei, it's got lobes on them. Okay, agranulated nuclei is round or kidney shaped. Okay, all about the same size. The agranulated varies in size. The granule will stain in the right stain. Okay, it will stain differently. Lifespans from hours to days, is produced in the bone marrow or are phagocytic. So they all, phagocytic is swallowing or eating the bacteria. So let's start with neutrophil. Okay, so neutrophil. So there are 3 types of granule. Okay, neutrophil, eosinophil, and basophil. If you can kind of make an acronym, okay, B, E, N. Okay, Ben. Okay, Ben has granules. Okay, so let's start with B. Okay, basophil has got granules. It is the rarest types of white blood cells. Rarest. Okay, nuclei is 2 lobes. Granules are large and dark and purple. Contain histamine and heparin. Is for vasodilate and chemoattractor. It promotes inflammation. So histamine promotes inflammation. Okay, that's why when you have an itch or something, you take antihistamine, and it will stop the inflammation. Most of the time, it is not a good thing. Inflammation happens for a reason, but sometimes you need it if it closes up your airway. binds to IgE. So we're going to learn what IgE is later. IgE stands for immunoglobulin E. Okay, immunoglobulin E. It will cause release of histamine. Okay, easy to mistake a lymphocyte because of the granules. So now we have E, eosinophil. 2 to 4% of white blood cells, okay, same size as a neutrophil. Bilobe, it's got 2 lobes. Remember these, okay? These attack parasitic worm, lessen allergic reaction by phagocytosis, okay? It's got large red-orange granules. This is the antihistamine one. We just talked about histamine one down here. Okay. So E is antihistamine. Okay. And it attacks worm and parasites. Basophil, it releases histamine and heparin. Neutrophil, 50% to 70% of the white blood cells. So there's a lot of them. They're 2 times larger than red blood cells. Okay, but still, of course, very, very, very few compared to red blood cells. Okay, it's got 3 to 6 lobes. Okay, it's called PMN or polymorphic nuclei. Okay, partial to bacteria and fungus. Granules, small and stained iliac. Hydrolytic enzyme. It's got defensin. Defensin is an enzyme that kills things. Oxidizing substance. It's kind of like a bleach. And hydrogen peroxide. It's got lysosome, so it will digest things. Okay, so this would be neutrophil. So these are all granules. Okay, 3 granules are Ben. Basophil, eosinophil, and neutrophil. So those have granules. Now, without the granules, much less, far less than the granules ones. Okay, you have lymphocyte, 25 or more of the white blood cells. They live longer. The size, most are found in the lymph tissue. That's why it's called lymphocyte. They're mostly found in the lymph tissue. But this will also